All right, so here a 70-year-old man presents to the clinic with progressively worsening shortness of breath and a dry cough that has persisted for several months. He denies fever, weight loss, hemoptysis, or chest pain. He has never smoked. His past medical history is unremarkable. He worked for over 30 years installing insulation in commercial buildings and retired a decade ago. Physical examination reveals decreased breath sounds and dullness to percussion over the lower portion of the left lung. Chest imaging demonstrates a unilateral pleural effusion and irregular areas of pleural thickening with focal calcifications. Diagnostic thoracentesis reveals an exudative pleural effusion with markedly reduced glucose concentration. Which of the following prior exposures most likely explains this patient's condition? All right. So here, not the age again, a 70-year-old man. All right. So some experience, shortness of breath. Now he denies fever, weight loss, hemoptysis, or chest pain. If he didn't deny fever, weight loss, or hemoptysis, you're thinking more lines of TB, right? And that's of course dependent on the rest of the vignette. So the exposure he has, or he has had to people who have TB. He's never smoked, so you're taking away some other options with that. 30 years installing insulation, and that should tell you where this is leaning, right? So asbestos. That's a thing that used to be in insulation for a while, right? So asbestos. Okay, so dullness to percussion to the lower portion of the left lung, and you can find pleural effusion as well as thickening, so calcifications. So that's usually what happens. So that asbestos will be inhaled, it's going to go to the alveoli, it's going to migrate to the pleura, and it's going to end up with calcifications over there. All right, so again, everything is pointing towards asbestos here. So it's exposure to asbestos. Now looking at the other options, coal dust, right? So coal dust is with the coal workers pneumoconiosis, right? So coal workers pneumoconiosis. Okay, now you're usually going to see upper lobe nodules with this one, right? So it doesn't really cause pleural plaques. Beryllium is an interesting one. It sort of mimics sarcoidosis, right? So you're going to see that chronic granulomatous disease, right, of the lung. So it mimics sarcoid. So you're going to see a granulomatous lung disease. Okay, silica particles also, just like coal, targets the upper lobes. So upper lobe. Okay, and you're also going to end up with eggshell calcifications. So eggshell calcifications around the hilar lymph nodes, right? So again, middle of the chest, just look there. So remember, for instance, if you look at TB patients, you're going to have hilar lymphadenopathy, and it's going to show, right? Now, that same location, you're going to see what looks like eggshell calcifications, again, in that same region, right? So hilar lymph nodes. Hilar lymph nodes. Okay, radon gas is kind of a risk factor for lung cancer, but you don't really see pleural plaques, so you get to take that out, right? Organic grain dust. So this is talking about hypersensitivity pneumonitis. So hypersensitivity pneumonitis. Okay, and also just look out for if someone has exposure to birds or mold or something like that for hypersensitivity pneumonitis. Okay, polyvinyl chloride is a risk factor for hepatic angiosarcoma. We're not talking about lung cancer here, or pleural disease. So hepatic angiosarcoma. Okay, all right, see you in the next one.